Pihak kami telah menjalankan satu kaji selidik bertujuan untuk mengetahui kefahaman dan pengetahuan pejabat awam di negara Brunei Darussalam mengenai gejala dan kesan stroke. Seramai 428 orang telah menyertai kaji selidik tersebut dan antara dapatan dari kaji selidik adalah rata-rata hampir semua pernah mendengar tentang istilah stroke. Tetapi majoriti sebanyak 62% hanya mempunyai pengetahuan yang sederhana sahaja. Kebanyakan tidak mengetahui sepenuhnya cara mengenal pasti amaran stroke serta faktor atau risiko yang mengakibatkan stroke. Dari sinilah pihak kami mengungkayahkan webinar pagi ini dengan objektif untuk memberikan kesedaran dan pengetahuan kepada pejabat awam mengenai stroke. Webinar ini akan dibahagi kepada 2 sesi, di mana sesi pertama akan membincangkan apa itu stroke dan apakah kesannya, dan adakah anda berisiko. Sementara sesi kedua pula, kita akan mendengar mengenai pilihan hidup sihat untuk mengurangkan kejadian stroke. Untuk makluman semua, webinar ini akan menggunakan Slido bagi sesi soal jawab. Kod untuk menyertai Slido adalah COP3. Sekali lagi diulangi, COP3. Sehubungan dengan ini, sukacita menjemput peserta-peserta untuk menyampaikan sebarang pertanyaan melalui Slido tersebut dengan menyatakan nama dan jabatan kementerian masing-masing. Baiklah, tanpa membawa masa, kita teruskan dengan sesi pertama webinar bersama penceramah jemputan Dr. John Matthew. Dr. John Matthew merupakan konsultan and head Department of Neurosurgery, Pantai Jerudong Specialist Center. Dr. John Matthew will be sharing with us on what is a stroke and what are the risk factors that contribute to a stroke, how to identify a stroke, the signs of a stroke, and what to do when a stroke happens. Please, Dr. John Matthew.
Good morning. I'm sorry it's taken a little time setting it up. I just want to thank Nazira and the marketing department of Pantai for organizing this meeting. And I also want to thank you for inviting me to talk to you all. I'm not going to do a very detailed description of stroke on a medical level. I'm just going to talk to you all on a very simple, basic level. And I'm hoping that all of you will understand what I'm trying to say. Today we're going to talk about the brain. And I don't know how many of you have actually seen the brain as such, but this is what a brain without the blood vessels look like. And this is the front part of the brain, and this is the posterior, the back part of the brain, and this is the bottom part of the brain, and this is the main part of the brain which we call the brainstem. Now, just a minute. I hope this will make it more clearer. All right, so this is the MRI that I've taken so that you understand the position of the brain with respect to the entire skull. And you find that this is the front part of the face, and this is the back part of the face, of the head. And that's the nose, and that will be your tongue. And the brain sort of is settled in the skull here in this position. So you can now understand this is the front part of the brain, and this is the back part of the brain, and this is what we call the cerebellum. And this is the most crucial part of the brain we call the brainstem, because this is the part of the brain which actually takes care of your breathing, your heart, and this part is the one which deals with your consciousness. So the crucial part of the brain is actually here, which keeps you alive. And this is the one which has the various different functions. Now, I thought I'll tell you something about the functions of the brain, because if you really want to know what stroke does, you have to have an idea about what the functions of the brain are. Now, this is the right side of the brain, and that's the left side of the brain. And the right side, as you all know, controls the left side of the body. So if you have a stroke and you have a stroke involving a blood clot here, it affects the left side of the body. And the right side is also involved in orientation, the orientation with respect to the surroundings, the orientation with respect to the body. I mean, if you have seen a child has no concept of space. And that's why you find the baby is actually biting its hand, it's biting its feet, it holds its feet. It is basically, the brain is recording the orientation of the body in the brain by all these maneuvers. It's all like, it's sort of like a data collection, and it collects the data, and all this is stored in this side. So this side is basically part of the geographical orientation, the topographical orientation. And it's also, it's the part of the memory is also stored here. So you could say that this side is more of an arts type, and this is more of the sciences type, because this part, in addition to the fact that it controls the right side of the body, it also is the one which is responsible for language, reading, writing, mathematics. Now, whenever I'm talking to you, you have to listen, and the bodies and the brain sort of recognizes words, and there is a comprehension center. You have to understand what I'm trying to say. And after you understand what I'm trying to say, what I've said, you then respond. And you start talking. So this entire center of hearing, understanding, and speaking is all in this side. And a little behind is actually the mathematics, the skills, the mathematical skills, your ability to count, etc. is all here. And you also have a certain part of the memory on this side also. So if you have any damage to this part of the brain, then you would lose control on the right side. That is, your right side will be weak, and you'll also have difficulty in processing information. You will not understand what I'm saying, and you might talk, but you may not, you don't know what you're talking about. And this part of the brain is actually the personality or the thinking part of the brain. This is where you, as all civil servants, you use your personality, think about the various programs that you want to do. It's all abstract thinking. All this happens in the front part of the brain. And you can, if this part of the brain is affected, these parts are there, you still can walk, you can still move around, eat, and remember a lot of things, but you cannot be able to deal with a lot of abstract thinking.
Apologies, Dr. John. Sorry, Dr. John. Your voice is a bit small.
I'm sorry.
Let's try that again.
Can you hear me now? Is it better?
Slightly better. It's a bit echoey.
Oh, it's probably because of this room is, let me. Okay, I'll talk a little louder. I hope it helps.
Okay. It's fine, yeah.
Okay, so this is the part that you actually find that the right side, this is part of the vision, wherein this controls your vision. Now, if you look at it, I'm going to give it to you in the lateral aspect. I mean, looking at it from the side, and this is the front of the brain, and that's that's what we call the frontal lobe. I know people might use different words, and we divide it into the frontal lobe. The front of the brain is called the frontal lobe, and this is involved in thinking, speaking, and this is the parietal lobe, and this is where your function, the weakness, the control of the body is at this part of the brain. And this part, as I said, the posterior part is where the vision is in control. And this part of the brain is where your memory is, the memory functions. Now, this part of the brain is called the cerebellum, is where the coordination and balance is. I mean, you can start walking, but the fine, if this one is affected, then you'll be walking like one of those robots, and you will not have that fine movement and the fine balance and the coordination. And as I mentioned earlier, this part of the brain is the one which deals with breathing, the temperature, and the heart rate. Now, today I'm going to talk about stroke, so I thought I should tell you something about the blood vessels. Now, this is the brain image with the blood vessels. The blood vessels come from the heart, it goes up the neck, and it enters the skull. And then it goes as these are the branches, and then it branches further branch, and it becomes smaller vessels, and they supply different parts of the brain. Now you can see that if this part of if there is a block in this particular area, this entire part of the brain doesn't get the blood supply. But blood supply will be available here, and it will be available here, but there will not be any blood supply here. So there are different vessels. If this particular vessel is affected, then you will not get blood supply to this particular part of the brain, and your vision will be affected. Now, how do you see the blood vessels? What we do is what we call an angiogram. An angiogram just means that you're injecting some contrast or dye into your blood vessels and then taking an X-ray. And this is what you would find. And you find that this is the major blood vessel. It's called the internal carotid artery. I didn't want to put in big names, but this is a major vessel that comes there. And it goes around and it divides into major branches, and it supplies different parts of the brain. So this is called the cerebral angiogram. Now, what is stroke actually? A stroke is basically a disease of the blood vessels. And this disease affects the blood supply to the brain. And then you have a stroke. Now, there are two types of stroke that you can have. One is a bleed and one is an infarct. Now, if the pressure in this blood vessel increases, then what happens? Like anything, if the pressure inside any tube increases, it bursts. And it bursts and all the blood vessels come out. Some part of the blood will continue in this direction, some part of the blood will continue, but a major part of the blood will continue and it will collect here. And that is what we call a bleed. Now, the infarct is when some blood clot has gone and blocked this vessel. So blood can go this way, but blood does not go through this way and it gets blocked. Now, some people say that this is a blood clot, and some people also say that this is a blood clot. So you can get a little confused about blood clot, but you should remember that one is a blood clot outside the blood vessel and one is a blood clot inside the blood vessel. A clot in the blood vessel, and that's the blood vessel, and there is a clot there. And what happens? This part of the brain doesn't get blood. Now, if you do a CT scan, and I've put up a picture of a CT scan, you find that it is black here. The entire part is black. Now, if this is the normal brain, which is gray in color, that's normal. But this is black, and that means that this part of the brain is damaged, and therefore it cannot work because it has not received blood supply. Now, in the other instance, you find that this has ruptured. blood has gone out and it is collecting outside of the blood vessel, a hemorrhage, and you find that this one is white. You find it as a white collection of blood. Now, blood in the CT scan appears white. And you find that there is a big blood clot outside the blood vessel, and it is collected inside the brain. Now, I just wanted to tell you, this is a pathological specimen. You've taken a specimen from a person who's died of a stroke, and then you sectioned the brain, and this is what it looks like. You can find that this part of the brain has not received any blood. I mean, the blood supply should have come like this, but it got blocked and this got damaged. Now, what I wanted to show you, this is a picture of a piece of land which is suffering, does not have water. It's droughts situation here. You can see that the entire land is dry and there's nothing that grows there. There's no function there. But what I wanted to highlight was this land, the structure is still the same. It has not changed much. So if you pour water there, you're supposed it will start growing. Now, if you do an angiogram, you'll find that the blood comes this way and it goes this way to one area, to different areas, but it does blocked here. And this part of the brain doesn't get blood. And therefore, this is called a stroke. So this is actually the normal. If you look at the normal, I'm looking at it from the side now. This is from the front and this is from the side. If you look at it from the side, you'll find that whole area is full of blood. But here you find this part of the brain has got blood, but this part of the brain is absolutely devoid of any blood. And therefore, you can see that this part is blocked. What we call the middle cerebral artery is blocked, and therefore there is no blood flow here. And this is what leads to a stroke. Now, in a bleed, the bleed, as I mentioned earlier, the bleed comes outside the blood vessel, and there's a huge bleed here. And it destroys the entire brain. If you look at this place, you find that there's a flood, there's a lot of flood, but it has gone beyond the river and it has damaged a whole lot of roads and the trees, etc. There's a lot of destruction. The bleed is quite destructive. It destroys. Now, a lot of people say that I had a patient who she came and said, listen, my patient is not doing well, but there's another patient here. He also had a stroke, but he is doing well. Why is it that my husband is not doing well? And that is because there are different bleeds. I mean, there are so many blood vessels that each of these blood vessels, any of these blood vessels can be affected. So, for example, you can have a bleed here, and this might affect his, if it is on the left side, it can affect his mathematics, it can affect his calculations, but he will not have any other weakness. Now, this is a bleed which is deep inside the brain, and that can affect a certain functions of the brain. Now, this is a bleed which is spared the brain, but there is blood within the fluid system. So this hasn't damaged the brain. There's only blood in the fluid system. So this particular patient, though he has had a stroke, might end up recovering well. Now, there is another condition, and a lot of people in the older age group, this is slightly different, but all I wanted to say is that there is blood clot outside the brain. And this is the skull. The skull, and this is the covering of the brain, and there between the skull and the brain there is a lot of blood clots here, and remember, if I remove this blood clot, the brain per se is not affected, and therefore you might have a reasonably good function after removing the blood. So in a scan, you might find that there is blood clot here, and there is a blood, this is a CT scan, this is an MRI scan. In the CT scan, you can find there's a large blood clot here. This is quite a large blood clot, but the brain per se is not affected. And therefore, if you remove this blood clot, the brain can still function normally. This is something that you find in the elderly age group, people who are quite older. And what happens is the brain sort of shrinks. And once it shrinks, there is a lot of space between the skull and the brain. And sometimes a blood clot forms between that space. Now, the bleed can be different sizes. I mean, it all depends on how much of pressure is there in the blood vessel. If the pressure is very high, then the blood once it ruptures, it continues to come out in large, copious amounts. So you have here a blood clot, and you can find anything that is white is blood. So this is blood clot here, but there is blood here, there is blood here, there is blood in the ventricles. And you find this is a massive hemorrhage, a massive hemorrhage. This has destroyed a lot of the brain. And therefore, such a patient would actually come with a very poor condition, neurological condition when he comes to the accident emergency. Now, if you look at this, there is a small blood clot. This patient probably can get away without much deficit because it's a small blood clot. So again, the bleed can be different. It can be massive or it can be minor. So I've sort of given you a reasonable overview of what the brain is, what the functions of the brain is, where the brain is supplied blood vessels, and what stroke is all about. Stroke is basically something, pathology that affects the blood vessel. Now, bleed is basically the pressure in the blood vessel is so high that it breaks the blood vessel, it ruptures the blood vessel. And what is the most important cause? Uncontrolled hypertension. The pressure in the blood vessel is very high. The blood vessel, the wall of the blood vessel cannot hold the pressure. It tears. And once it tears, all the blood comes out of the blood vessel. What is a block? As I said, infarct, the other type of stroke that I was talking about. This causes damage to the insides of the blood vessel. It damages the insides of the blood vessel, and therefore a little bit of cholesterol gets deposited, and it slowly narrows the. It's like something blocking a water pipe. There is something getting stuck inside, and it's gradually the amount of water that comes out is less. Similarly, you have diabetes and atherosclerosis damaging the inside of a blood vessel, and this causes a block. Now, the severity of the stroke, how bad it is, depends on the extent of brain damage. Now, a lot of people have said, okay, these things have happened. How do we recognize it? How do we know that I have had a stroke? And the Stroke Foundation has come out with something called a PFAST. It's an acronym which you can remember, something that you can keep in mind. So basically, B stands for balance, a sudden loss of balance. When you're a normal person and suddenly you lose balance. And that is because the balance center is not functioning normally. Sometimes you have E is for eyes, and that basically is there's loss of vision in one or both the eyes. The vision is blurred. Sometimes you cannot see. Sometimes there is total loss of vision. Face. The face doesn't look uneven in the sense that your mouth tends to droop. The mouth is drooping to one side. You try to drink some water. The water flows out through one side of the face. This means that the face is affected. The arm or the leg weak. I mean, you find that this tends to droop down. This is not functioning. If it is the right side, that means the left side of the brain is not functioning, and therefore you have weakness on the right side. The speech, you find that you can't speak, you can't form words, you have difficulty talking, or when you talk, your words, the speech is not normal, and therefore you find that there is trouble speaking, or you seem to be confused. Now, T is, some people say T is time to call, and some people say T is when you have a terrible headache, when there's a rupture of the blood vessel and a lot of blood comes out, you have a severe headache. It's something that you've never experienced before. You call it as if a thunder hit you within your head. So I look at, this is the PJC had actually promoted the World Stroke Day. They had a series on strokes. So they talked about balance, and the balance is basically, sometimes it can be when this part of the brain is affected, the blood vessel to the cerebellum is affected, you can have a problem with balance. Or if sometimes if there is weakness, one side is weak, again you can have an imbalance. Eyes. Now eyes, when this part, I told you earlier, this is the vision part, the occipital lobe. Now, if the blood supply to this occipital lobe is affected, your vision may be affected. Sometimes the two eyes are here, and if the blood supply to the eyes themselves are affected, then the eye will stop functioning. Face drooping is when there is weakness in this part of the brain. This is the part that, as I said earlier, controls the right side of the body. It includes the face and the right hand and the left and the right leg. So if one side of the body is weak, you can have face drooping, and you can also have arm weakness. Speech difficulty is basically two reasons. One, you can have the speech center affected, or it also could be because of the weakness of the face. You cannot form words. Your muscles are weak on one side, and therefore your words are not properly formed, and therefore it is slurred. And here in PJC, we said T stands for not terrible headache. We said time to call 991. Now, if you have a stroke here, you may not survive, or you might have you might come with loss of consciousness. Now, what happens if you have a stroke here? Sometimes you have a stroke here, it may not be recognized because it is basically about your thinking and abstract thinking and ideas and formation of ideas and concepts. So if you're a person who doesn't think much, doesn't have too much of abstract thinking and all this stuff, this part of the brain, if it gets damaged, you may not actually notice it because this function is not used by you. Now, other signs of stroke, as I said earlier, if the conscious center is affected, you can have loss of consciousness, have a severe headache when there's a massive bleed in the brain. You can have loss of balance because of the balance center is affected. You can have trouble seeing, you tend to see double, or you find that you're not able to focus on objects, so you have trouble seeing, or you have a dizziness and vomiting. So what are the predisposing conditions? Now, there are a lot of predisposing conditions in stroke, and I don't want to give a medical lecture on it. So I'm going to talk to you about the ones that is very common. So it's not a full causes of the predisposing conditions for stroke. So I might have missed some. The main thing is hypertension. High blood pressure. High blood pressure causes rupture of the blood vessel, and therefore hypertension is one of the major problems that we have. Second is diabetes mellitus, uncontrolled sugar. Uncontrolled sugar causes damage. Sometimes what happens is diabetes, uncontrolled sugar can affect your kidneys, and the kidneys have a role in maintaining a blood pressure, and therefore your blood pressure increases, and that can also lead to a rupture of the blood vessel. Heart diseases. In the elderly, you find that heart diseases can also cause a stroke, because sometimes if there is a problem with the rhythm in the heart, the blood does not get pumped very well, and therefore you might have uh, a clot forming in the heart, and this clot can get pumped up into the brain and it can block one of the blood vessels. Now, which are the two features which can aggravate all these things? One is smoking. Smoking has a deleterious effect. Unfortunately, Brunei, it's at least in the hospitals and in the areas around it, you don't find many people smoking, though in other areas you find them. But smoking is injurious to your brain. Physical inactivity is another major cause for stroke, and the reason is you tend to put on a lot more weight, you tend to eat a lot more, that whatever you eat, the calorie is not spent, and therefore it gets stored in the body. Obesity increases blood pressure because the heart has to beat with lot more force for the blood vessel to reach the different parts of your body. So if you have about 5 or 6 centimeters or inches of fat, then the heart has to pump harder for the blood to reach your skin. So it requires a lot more of energy, and therefore increases the blood pressure for the blood to reach different parts of the body. So basically, it's time, save precious time. The reason is stroke affects the brain. Brain, each cell, it doesn't take much. It just takes about 4 to 5 minutes for the if there is no blood supply to the brain in 4 to 5 minutes, that part of the brain gets damaged. But if you look at the circulation, there is a lot of connections in different parts. It is as if the body recognizes the importance of the brain, and it is trying to supply blood from different parts. But if you delay in recognizing a stroke, and if you don't do something about it, then more and more of the brain gets damaged and the recovery is poorer. So in this particular thing designed by one of my colleagues, he's trying to say that if there is arm weakness, if there is face drooping, if there is speech difficulty, please, it's time to call 911. Say it is a stroke, accept it is a stroke, and call 911 and go to the emergency as early as possible. I think this is my last slide, and I think I've completed my lecture.
Thank you, Dr. John, for the comprehensive explanation. And later we will give the floor again to Dr. John to continue our talks after we hear from our guest speakers from the Health Promotion Center. That is very insightful, Dr. John. Thank you so much for sharing us the knowledge about the brain, the functional areas of the brain. I learned something new. I'm sure all our participants have learned something new as well. The different bleeds, different factors contributing to a stroke, and especially the warning signs of a stroke. That's very important. Be fast. I think that's a very important acronym to remember. BEFAST, be fast. It's easy to remember, and I hope our participants will remember as well. So just to refresh, we do have the question and answers session later after we at the end of the webinar. So to all participants, may I remind that you can log on to Slido, the sli.do, to pose all your questions for our presenters, and use the code COP3, and then we will have a run through of the questions later when we finish with our presenters. So we shall now take a 5 minutes break before we move on to the next session. See you in 5 minutes. Baiklah, kita mulakan sesi kedua pada hari ini mengenai apakah perubahan yang boleh Auda lakukan untuk meningkatkan kesihatan. What kind of changes can you make to improve your health?
Untuk makluman peserta sekalian, berdasarkan keputusan kaji selidik yang dijalankan oleh pihak kami, sebanyak 90% responden menjawab bahawa tekanan atau stres adalah antara faktor risiko yang mengakibatkan terjadinya stroke, diikuti dengan obesiti seramai 64% dan kurang bersedar sebanyak 54% menjawab. Kita mengalu-alukan penyampai-penyampai kita bagi sesi kedua, Puan Siti Nazira binti Haji Abdullah, psikologis Pusat Promosi Kesihatan, dan Puan Siti Nadira binti Haji Rawi, Pegawai Pelajaran Kesihatan, Pusat Promosi Kesihatan Kementerian Kesihatan. Kita mulakan sesi ini dengan Puan Siti Nazira untuk mengongsikan mengenai pentingnya menjaga kesihatan mental bagi mencapai kesihatan menyeluruh. Silakan Puan Siti Nazira.
Assalamualaikum warahmatullahi wabarakatuh. Thank you for having us here today. Jadi, I will share my screen. Sekejap. So much. All right. So hari ini I will be talking about mental health and also how to improve your mental health for stroke prevention. Jadi nama saya Siti Nazira Haji Abdullah. Saya seorang psikologis dari Unit Strategi Kesihatan Mental Health Promotion Center atau Pusat Promosi Kesihatan. Okay, so sebelum kita ni bercakap pasal kesihatan mental and also steps untuk improving our mental health untuk mencegah stroke, I think it's necessary for us untuk to explore apakah dia kaitan stroke dengan kesihatan mental. Jadi as we all know, stroke ini is a physical medical condition, tapi apa kena mengenanya dengan mental health. So first we will look at this diagram here. Jadi we can see that health ini ataupun kesihatan adalah terdiri daripada 3 different components, 3 komponen yang berlainan. Dan these 3 components ini are actually interconnected. Jadi from definition dari WHO ataupun Pertubuhan Kesihatan Sedunia, kesihatan ini adalah keadaan yang lengkap dari segi physical, mental dan social, dan bukan semata-mata ketiadaan penyakit atau kelemahan. Jadi health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. Jadi dari sini pun kita ni dapat lihat bahawa these domains ini are all connected with one another. Jadi if we always talk about health ini, usually kita ni fikirkan about physical health saja, and stroke is under that umbrella lah. Stroke is under physical health. Tapi we cannot achieve or we cannot talk about health without also considering mental health and also social health, and they will affect one another either secara langsung ataupun secara tidak langsung. Jadi from this diagram juga we can see that kalau sekiranya kita ni improve our physical health, we will also be improving our mental health and social health. And also vice versa. Jadi kalau kita ni do any lifestyle activities that will merosotkan kita ni punya physical health ataupun kita ni punya mental health, jadi all these other components pun will be affected juga. Jadi when we talk about health, we cannot just simply talk about physical health sahaja ataupun mental health sahaja ataupun social health sahaja. Jadi all these 3 are actually interconnected. Okay, so next, first I want to introduce juga apakah dia kesihatan mental. Jadi according to WHO atau Pertubuhan Kesihatan Sedunia, kesihatan mental ini adalah keadaan kesejahteraan ataupun a state of well-being di mana seseorang itu menyedari tentang keupayaan dirinya sendiri, dapat menguruskan tekanan stres dengan baik dan dapat bekerja secara produktif dan mampu menyumbang kepada masyarakat. So in English, it is a state of well-being in which an individual realizes their own potential or abilities can cope with normal stresses of life and can work productively and is able to make contributions to his or her own community. Jadi kesihatan mental ni, as we can see, everybody has mental health, just like how everybody has physical health. Kesihatan mental ni is how we express ourselves, how we express our emotions, dan menunjukkan juga kita ni punya keupayaan untuk menyesuaikan diri kita ni dalam pelbagai situasi lah yang penuh dengan tekanan ataupun tidak. Jadi how we can adjust to the situation and environment and our lives. Jadi as I said, we all actually have mental health ni, tapi ramai orang salah faham about mental health ni. People might think that it's macam an on-off button, which means that people think that you can either have a good mental health ataupun you have bad mental health or you have a mental illness. Tapi sebenarnya we all have mental health, tapi what is different from one person to another is kita ni punya tahap of kesihatan mental kita ni, our levels of mental health. Jadi ada setengah daripada kita ni mempunyai kesihatan mental yang baik, ada yang menghadapi masalah kesihatan mental, dan juga ada setengah daripada kita ni yang ada kena diagnose dengan kecelaruan mental, and kecelaruan mental ni is mental illness. And it's not just an on-off button that we can switch on and switch off. Jadi it's in a spectrum. Jadi kalau sekiranya maybe at one point in our lives we will have good mental health, but perhaps in different phases of our lives kita ni mungkin ada banyak tekanan stres dari rumah kah ataupun dari keluarga kah, dari pekerjaan. Jadi if we don't handle the stress very well, maybe we will encounter mental health problems. Dan dari sana, if we don't address it lagi, perhaps it will eventually turn into a mental illness. And it doesn't mean that once kita ni diagnosed with a mental illness that we cannot go back to having good mental health. That's not what it means. So it is in a spectrum. Jadi di mana kita ni boleh, it is ever changing and ever fluctuating. So we can move from one point to another. With self-care, with social support, with professional treatment. So as I said, kita ni semua mempunyai kesihatan mental. Tapi what is different is our levels of mental health. Okay, so apakah dia kecelaruan mental? So what is mental illness ni? So kecelaruan mental ni adalah satu masalah kesihatan. So it's a medical condition di mana yang melibatkan gangguan perasaan kita ni, our emotions, and it changes kita ni punya cara pemikiran, perasaan kita ni, dan also our behaviors, our tingkah laku. Jadinya it's not macam the stigma that is around mental illness right now is that it is some people say it is orang gila, or that you are just lemah, or ada yang orang cakap kurang iman and things like that. Tapi that's very wrong lah, very false. It is actually just a medical condition. It is masalah kesihatan. Dan mereka yang mempunyai kecelaruan mental ni akan mengalami satu keadaan di mana tahap mental seseorang itu menyebabkan fungsi seharian mereka terjejas. Jadi diorang punya daily functions are affected, sama ada dari segi sosial ataupun dari segi pekerjaan. So whatever that we can do very easily, like getting out of bed, going for a shower, taking care of ourselves, bagi diorang is very hard. So it really impedes on your daily functioning. Dan kecelaruan mental ni adalah satu bentuk penyakit, as I said, dan bukan petanda watak yang buruk. So it doesn't mean that you are weak. It is just a medical condition di mana mereka akan memerlukan rawatan. So rawatan itu pun will be according to the severity of dorang punya mental illness itulah. We will go into the signs and symptoms. Jadi tanda dan gejala kecelaruan mental ni, some people think just because the name is mental illness that maybe it will just affect things that are going on in your mind ataupun anything to do with the brain lah. Tapi people forget that the brain actually controls your whole body. So the brain is the center of all information and center of control for your whole body. Jadi badan kita ni physically pun will be affected as well. Jadi tanda-tanda dan gejala kecelaruan mental ni boleh dari segi pemikiran, the way we think, our emotions, physical, dan also our behavior. So dari segi pemikiran, most people yang diagnosed with kecelaruan mental ni will merasa takut atau bimbang yang berlebihan. Again, this is very surface level lah ya, where what I'm explaining ani, I can probably get into this more. Tapi it's lain daripada kalau kita ni rasa takut dan bimbang kalau perkara-perkara biasa, tapi ini yang berlebihan and it's chronic and it is macam indah selaras dengan apa situation that they are experiencing at that moment. Mereka merasa bersalah or feeling a sense of guilt, pengasingan daripada reality, hayalan, paranoia ataupun hallucination, ketidakupayaan untuk menghadapi masalah atau tekanan harian, masalah memahami orang dan mengaitkan situasi, dan also suicidal ideation, berfikir untuk membunuh diri. Jadi suicidal ideation ini is not just a suicide attempt, tapi also even thinking of things like the world will be better off without me, and things like that is also kirakan suicidal ideation juga. So we move on to emosi, merasa sedih atau gelisah yang berlebihan, and ini it will be berlainan, macam different mental illnesses will show differently lah. Tapi just in general, if I were to put it all together, mereka akan merasa perubahan mood yang berlebihan. Jadi moodnya tinggi rendah macam di mana-mana lah. And then they will feel angry, kemarahan, pemusuhan, and also keganasan yang berlebihan. And you can see here banyak I put in berlebihan. Jadinya it's not macam normal mood fluctuation lah. Macam kita ni memangnya as manusia pun we have mood fluctuations. Tapi with people with mental illness, the fluctuations are more seen, more significant. And then dari segi physical, mereka akan merasa letih, yang ketara, jadinya macam walaupun ada buat aktiviti fizikal yang like very heavy strenuous exercise pun, they will feel very lethargic, kurang tenaga, ada masalah tidur. Masalah tidur itu either payahkan tidur ataupun kalaunya sudah tidur ya keep bangun malam ataupun ya bangun awal pagi, anda cukuplah dan mungkin dalam 3-4 jam saja tidur cuma tu. Sistem imun dorang pun lemah, jadi because sistem imunnya lemah, jadi badan mereka pun sukar untuk menahan jangkitan, jadi selalu rasa demam. Tekanan darah tinggi, sebab macam sekiranya kalau orang yang menghidapi masalah anxiety disorder, their heart rate will be high almost sentiasa lah. They will always feel like they are in danger. Jadi they will have palpitations, high heart rate. Jadi ini kalau sudah ya chronic ataupun berpanjangan, this will raise dorang punya blood pressure jadinya. Dan ini pun meningkatkan risiko menghadapi penyakit jantung, and also the topic of today, stroke as well. As Dr. John tadi mentioned that tekanan darah tinggi itu is one of the risk factors of stroke. So this is where you can see as well the sort of the association between stroke and also mental illness. And then lastly also they will encounter masalah sistem penghadaman or digestive system. I think perhaps Dr. John will be able to explain this further, but there is actually a direct connection from our brain to our gut. Jadinya apa yang ketani makan itu, and if sekiranya nda healthy pun apa, or kalau sekiranya ketani punya sudah cara pemikiran ketani sudah merosot, it will affect ketani punya gut health juga. Jadi that's why kalau sekiranya orang yang macam banyak stres apa tu, diorang kan merasa masalah penghadaman seperti dugal ataupun ceret-beret, things like that. And then in terms of tingkah laku ataupun orang punya behavior, mereka akan menarik diri daripada aktiviti sosial, diorang mengasingkan diri dari rakan dan keluarga, penyalahgunaan alkohol atau dadah, dan also perubahan besar dalam tabiat pemakanan. Jadi either diorang makan lebih banyak ataupun diorang makan lebih sikit. Jadi ini pun boleh nampak with diorang punya drastic weight changes juga, because it also affects diorang punya eating patterns itu kan. Okay, next, this is just sharing juga because we do get a lot of questions about this. Jadi apakah dia punca dan faktor risiko kecelaruan mental? So what are the risk factors and causes of mental illness ini? So it can be anything sebenarnya. There's no one straight answer. Kenapa one person will have a mental illness or a higher risk of mental illness? So it can be biological, psychological, and also social, or it can be a combination of 2 or 3 of these factors. Jadi kalau, for example, sekiranya diorang ada sejarah or a history of mental illness dalam diorang punya direct family members, ataupun they ada situasi kehidupan yang penuh dengan stres, seperti masalah kewangan, ataupun ada bereavement, kematian dalam keluarga, condition, medical condition yang chronic seperti stroke as well, dan diabetes, kerosakan otak akibat kecederaan serius, pengalaman yang traumatik seperti peperangan ataupun penderaan, penggunaan alkohol, sejarah penderaan atau pengabaian zaman kanak-kanak. So if masa diorang punya childhood lah, they were isolated or sort of ignored by the parents, not being taken care of properly, kurang kawan ataupun kurang hubungan yang sehat. Dan also maybe diorang punya own sejarah of mental illness in the past, because actually 1 in 4 of people around the world will experience a mental illness at some point in their lives. Jadi it can be now, it can be sometime in the past, or it can be sometime in the near future. 1 in 4 of us will encounter it someday. Okay, sorry. So next one, jadi apakah kaitan antara stroke dengan kesihatan mental ini? Jadi in this chart here we see that actually mengikut kajian 1 dalam 6 stroke dikaitkan dengan kesihatan mental, and also risiko stroke meningkat sebanyak 24% dalam kalangan pesakit yang mengalami kecelaruan keresahan atau anxiety disorder. Dan also risiko stroke meningkat sebanyak 3 kali ganda di kalangan pesakit lelaki yang mengalami gangguan tidur. So I think I will talk about these 3 risk factors more in detail after this. Jadi what are some of the lifestyle changes that you can make ataupun perubahan gaya hidup yang boleh kita lakukan untuk meningkatkan kita punya kesihatan mental dan also at the same time menghindari stroke. Okay, so the first thing is untuk menguruskan kita punya tekanan stres secara positif, which I will talk about in a bit further after this. The second one is to stay healthy and active, kekal aktif dengan meningkatkan aktiviti bersenam ringan. So it doesn't have to be anything very strenuous, very vigorous. Even berjalan saja tiap hari for 30 minutes is good enough. Asal saja ada kita ni we move more and we don't stay sedentary. And then memakan makanan yang sihat dan seimbang, which my colleague Siti Nadirah will talk about after this. mendapatkan tidur yang mencukupi dan berkualiti according to kita ni punya age range juga. Then mengekalkan hubungan sosial untuk mendapatkan sokongan positif dari rakan-rakan dan keluarga, dan also mendapatkan sokongan profesional bila perlu. Once you feel that you need more help, more professional help, then we encourage for you to do so. Okay, so for menangani tekanan stres, so stres yang kronik, walaupun stres is not a type of mental illness, tapi stres ini if it is chronic, berpanjangan, and we don't address it, then boleh menjejaskan kita ni punya kesihatan mental and physical. Jadi kita ni we have to tenangkan diri dengan melakukan senaman pernafasan dalam or deep breathing exercises. And a very simple tip is the 3-6-9 method. So 3 saat kita ni inhale through our nose, and then we hold our breath for 6 seconds, and then we exhale through our mouth like blowing a candle for 9 seconds. So 3-6-9, it's very easy to remember. So 3 seconds you inhale, 6 seconds you hold, 9 seconds you exhale through your mouth slowly. So if we do this repeatedly, at least dalam 5 minit, kalau sekiranya we feel tertekan lah, if we feel like we are in a lot of stress and we just need some time to breathe, selalunya kalau if we are stressed, we forget to breathe, we hyperventilate. Jadi this will sort of calm you and sort of make you relax lah. It will also help you to fall asleep easily if for people yang susahkan tidur. Second thing is to set boundaries. So tetapkan kita ni punya limits atau kita ni punya batasan bagi ourselves lah, dan berikan masa untuk beristirahat dengan mengendalikan aktiviti yang membuat kita ni rasa segar or restored. Jadi this can be anything. For some people, this can mean drawing. For some people, this can mean actually going out for a walk or going to the gym, exercising. So this is very subjective from person to person. Jadi whatever that you feel makes you feel restored, create that time for yourself. If you say that you can't find time, then put it in your calendar, put it in your diary, set a schedule for it. And make it as important as a business meeting, and set your boundaries, meaning that kalau sekiranya the stress is coming from work, then your boundary sekiranya lah, for example, should be okay, by 6 o'clock I will not entertain any more work-related messages or things like that. On the weekends I don't want to look at my phone for work-related messages, things like that, simple. And then the third one is to dapatkan bantuan dan sokongan dari kawan-kawan, rakan sekerja atau ahli keluarga yang dipercayai. So jadinya kalau sekiranya you have a lot of work to do sekiranya lah di office, then dapatkan bantuan dan sokongan dari rakan sekerja, meaning that you share resources kah, ataupun you delegate. If there are things going on at home, at the same time things going on at work, maybe the errands that you need to perform at home itu minta orang lain buatkan to help you to run errands itu. Again, it will be good if it's someone that you can trust lah, so you can completely let go of that to-do list to someone else to buatkan for you. And then the second one is about sleep. So tidur yang mencukupi and also yang berkualiti. Jadi tidur ini is actually very important because ia berperanan untuk to restore ataupun memulihkan kita ni punya proses of biokimia and also physiology yang mula merosot semasa kita berjaga. Jadi artinya when we are awake ni during the day, our chemicals in the body are really working very hard, really grinding and helping us to live our lives. Jadi once we hit nighttime, our body needs to be restored. Jadi this is what happens when we are sleeping. We are restoring our body and our brain and our hormones and releasing all the toxins or washing away all the toxins. Jadi kalau sekiranya anda cukup kita ni tidur tu, anda cukup time for our body to be doing all the detoxifying and the repairing itu. That's why we need to have adequate amount of sleep. Jadi tidur ni juga boleh membantu dalam meningkatkan our concentration during the day, our focus and creativity while we are doing work. Mengawal kita punya mood juga. I think we can all say that kalau kita ni dah cukup tidur, we will be very cranky in the morning. Meningkatkan kita ni punya memory, daya ingatan, and also mengawal kita ni punya tekanan darah. So again, this goes back to hypertension lagi. Kalau sekiranya dah cukup tidur, you will see that your blood pressure is a bit high. Jadi if you can imagine, if you don't have enough sleep for several days, your blood pressure will keep being elevated. Jadinya this will perhaps lead to chronic high blood pressure, hypertension, and you will be diagnosed with hypertension because not a chance for it to turun. And it's very important for us to also keep a routine or sleep hygiene, what we call as sleep hygiene, supaya kita ni dapat tingkatkan lagi our sleep quality. And what I mean by sleep hygiene ini, I thought I shared. Okay, I didn't share. I thought I shared the slides for sleep hygiene. But what I mean by sleep hygiene ini is things like perhaps 30 minutes before you go to bed, you start dimming your lights so that it's no longer too bright, so that your body understands that it's time to sleep. And then put the gadgets away, maybe tutup segala phones or iPads or TVs for about an hour before you go to bed so that you don't have any distractions. Make sure that your temperature in your room is cold and comfortable for you. Perhaps avoid caffeine from the afternoon, because caffeine actually lingers in your body for about 8 hours as well. Jadi if you have it late in the day, it will still linger in your body and it will make it very hard for you to sleep. So things like that is what we call sleep hygiene. And then also last but not least is to dapatkan sokongan professional, to get professional help if you feel that your mental health or mental well-being is affected by things around you. So it's fairly easy now, alhamdulillah, with MOH having talian harapan 145. Jadi 145 ni is our mental health hotline that you can call every day dari pukul 8 pagi hingga 11 malam, and this is being manned by the mental health advisors atau penasihat kesihatan mental dari Kementerian Kesihatan. Jadi if you call this line, you will be talking straight to a mental health professional, and calls will be kept confidential. So anybody can call this number 145. It's free of charge, and we have it every day. We have it on every day. And then you may also go to pusat kesihatan yang berdekatan untuk mendapatkan medical assessment dari doktor. And then after that, they will send you for further consultations with psychologists ataupun psychiatrists, depending on what they find in their assessments. Or you can also call straight to the clinical or community psychology punya services with the number sini, as I put, 7212-697. So you can call this number straight to the psychologists. And this number, usually they only take Isnin, Rabu dan Sabtu lah masa pada waktu kerja. So you can call this number and sort of like book a slot and see if they have any empty slots to get you in for the day. Yeah, and I think that's all from me for now. And I will pass the floor to my colleague, Siti Nadira. If you have any questions, you can contact me from Instagram or the email that I provided. Thank you.
Terima kasih Puan Siti Nazira di atas perkongsian yang sangat berguna mengenai kesihatan mental, termasuk tanda-tanda dan gejala kecelaruan mental dan cara-cara untuk menangani tekanan stres, especially the 369 deep breathing exercises. I think that's very useful. And thank you for highlighting the importance of sleep, as well as the talian harapan 145. That's something for us to remember. Seterusnya mempersilahkan Puan Siti Nadirah untuk menyampaikan mengenai gaya hidup sihat dan amalan permakanan yang boleh diamalkan. Silakan Puan Siti Nadirah.
Okay. Assalamualaikum warahmatullahi wabarakatuh and selamat pagi everyone. Nama saya Nadira, saya seorang pegawai pelajaran kesihatan dari Pusat Promosi Kesihatan dari Healthy Eating Unit Penang di Pusat Promosi Kesihatan. So we deal with healthy eating policies and then also basically adalah to do with pemakanan sehat. So since masa is quite limited hari ini, I will try to do the best that I can untuk share. So in terms of pemakanan sehat, how is it related to risiko stroke atau kejadian stroke? So tadi I think ada Dr. John shared and also Puan Nazira also shared how sikit-sikit lah to do with pemakanan and how it can be related to stroke. So to be more specific, ada 3 faktor lah that I want to share, tapi hindi belum dapat cover everything dalam detail banyak lah. So but I will focus mengenai pengambilan garam and also pengambilan lemak lah. So the first one mengenai garam. Garam ini terdiri daripada zat galian sodium, so 40% sodium dan 60% klorida. Biasanya kena pakaikan sebagai penambah rasa, pengawet, and then ia boleh juga memberi tekstur untuk makanan. Tapi mostly untuk menambah rasa and also untuk menambahkan shelf life of makanan. Our bodies perlukan garam untuk fungsi otot dan keseimbangan cecair badan. So yang disarankan sebenarnya oleh Pertubuhan Kesihatan Sedunia atau World Health Organization disarankan untuk mengambil 5 gram garam setiap hari, which is dalam kurang dari 1 sudu teh sahaja. So kalau dapat bayangkan 1 teaspoon of salt, kurang dari 1 teaspoon lah, atau 2000 mg sodium sahaja. So sebenarnya garam ini kita ni perlukan dalam kuantiti yang sedikit sahaja, but yang pernah buat kaji selidik atau kajian dari Kementerian Kesihatan, we did find it's okay. Dari kajian Kementerian Kesihatan yang pernah kami buat dalam maybe a few years back lah, we did find that most of us will have excess intake of garam lah. Okay. So kaitan garam dengan kesihatan, pengambilan garam ini dalam jumlah yang banyak boleh menyebabkan tekanan darah tinggi atau hypertension, which Dr. John mentioned tadi, which is related to stroke and also penyakit jantung juga. And then dari kami punya our kaji sidik dulu that we've done before, around 1/3 of Brunei population has tekanan darah tinggi, but I don't think itu yang the updated figures lah, might be higher lah. Okay. Also just to share mengenai sumber-sumber garam, I think the picture, the photo itu is quite you can have imagine lah where sources of salt comes dari kita ni punya diet, but secara semula jadi actually ada garam dalam susu, daging dan makanan laut, so naturally ada occurring dalam food. Most of sumber garam ini will come from makanan yang berproses. So as you can see, yang listed mi segera, nugget, sausage dan makanan dalam tin will have high amount of garam. Snack-snack yang ringan seperti keropok. Also dalam sos dan perancah that we usually use, daily, kicap, sos tiram, sos tomato dan sos chili. So ini just to maybe we can bayangkan lah the one that was mentioned tadi yang kena recommend is 2000 mg sehari of sodium. So if you can see dalam satu bungkus mi segera is already dalam 1400 mg of sodium. So if we take sebungkus atau kadang-kadang ada yang ambil 2 atau 3 bungkus jua, you will easily exceed lah the sodium recommendation by World Health Organization. And then kalau for telur masin, you can see sebiji already 1000 milligram. So kalau kita ni makan 2 biji, you already exceed lah. And then dalam satu sudu makan kicap, there's already 880 milligram of sodium. So in the foods yang we usually eat lah, tinggi garam, tinggi sodium. Another one, for example, corned beef. Dalam 3 sudu makan saja, there's 376 milligrams of sodium. Keropok ubi kentang dalam satu bungkus kecil, almost 300 milligram. And then keropok udang tempatan, satu bungkus kecil already have 243 milligram of sodium. So you can see our makanan yang biasa kita ni makan lah, it will have a high amount of sodium. And then just to share just a bit more lah, ada macam French fries, satu cawan kentang goreng, 120 mg. So satu cawan damit lah, for example, that size. And then ada segenggam kacang tanah yang salted, 116 mg. When you compare it with yang unsalted di bawahnya, it's only 1.7 mg. Jauh lah the difference between the salted and unsalted kacang. And then we also have cracker beras, 3 keping already 15 milligrams. And then if you compare with macam oats, like amping half cup, 2.4 milligrams, and then sebiji pisang yang medium size lah, 1.2 milligrams. So we can see the difference between some of the foods that yang kita ni biasa makan and how far the gap is with the sodium content. And then just to share on how we can kurangkan our salt intake atau pengambilan garam. Kalau memasak, we can kurangkan by using secubit sahaja dan memasak. And then we can try to avoid or kurangkan lah menggunakan MSG. MSG pun is a big contributor to salt and our can raise your blood pressure as well. And then menggunakan sos perencah. So kalau sos perencahan ni ada yang macam ready made packets, pre-mix packets of macam untuk buat nasi goreng, untuk membuat macam so many things lah, macam ayam kari, daging rendang. So all of that usually has banyak garam dalamnya. So if we can try to kurangkan and to gantikan garam atau using this sauce perencah dengan rempah ratus atau herba-herba dan citrus. So citrus like limau kasturi. And then another tip, try to elakkan menyimpan garam atau macam sos kicap, sos chili di atas meja makan. So it will kurangkan your the need to add on to your food semasa memakan. Also to hadkanlah just to limit pengambilan makanan yang berproses, and try to pick makanan yang segar. So ini in terms of macam daging berproses atau nuggets kah, or we can change with macam fresh chicken, fresh daging, fresh fish. And then also macam kalau we try when we eating out or macam takeaways is part of kita ni punya culture lah. Macam I don't want to say in the boleh, but you can always make pilihan yang lebih sihat lah when you eat out atau when you tapau. So for example, boleh pilih nasi putih instead of nasi goreng, because kalau nasi goreng, of course they will add garam and other perencah. Try to ask for makanan yang kurang atau nada kuah. because the kuah pun can contain a lot of garam. Try to ask for less salt, not salty. Jangan masin when you go out. And then kalau kita ni, if we have people yang suka makan soto atau mi soup, there are some people yang tend to habiskan the soup sampai empty lah the bowl lah. So try to elakkan membuat ini because you will definitely exceed your salt intake by menghabiskan the soup. And then some more things. As you can see yang sebelah kiri ada 3 healthier choice logos. So the top one dari Brunei Darussalam, yang tengah-tengah is from Singapore, and then yang di bawah sekali is from Malaysia. So produk-produk yang display this logo on their packages, I hope bis kita ada pernah melihat lah when you go shopping. Any 3 of these lah, they comply to criteria yang kena set oleh Ministry of Health in Malaysia, Singapore and Brunei. So to get this logo pun mesti apply lah to get this logo onto that packaging. So products with this logo boleh menunjukkan that produk itu lebih sihat in terms of fat content, salt content, sugar content. So a healthier option compared to the other products yang similar lah. So hadkanlah try to get products that try to kurangkan makan snacks yang masin seperti keropok atau kacang yang bergaram, and then try to switch lah, try to have buah-buahan segar, and then look for products yang nada garam atau tanpa garam tambahan. So make sure to read the label or look for logos yang seperti yang di display sebelah kiri ya. Okay, so the second one will be mengenai pengambilan lemak. So lemak ini is has the highest calorie content lah out of other nutrients. So ada 9 kalori dalam 1 gram lemak kalau dibandingkan dengan carbohydrate atau protein which has only 4 kalori. So high calorie nutrient, ia boleh membagi tekstur atau perasa dan aroma untuk makanan. And then jenis-jenis lemak atau kategori lemak, ada lemak tepu which is saturated fat atau lemak tidak tepu which is unsaturated fat. So in terms of WHO punya recommendation, disarankan untuk mengambil tidak melebihi 30% pengambilan jumlah tenaga keseluruhan dalam seharian. So out of your total daily intake, we try not to exceed 30% lah. And then kalau lemak tepu, we try to reduce to less than 10%. And then also kalau lemak trans fat is another category of fat pun atau ini dapat melebihi 1%. In terms of saturated fat atau lemak tepu, the sources are usually macam from animal products lah atau macam animal fat, lemak daging, kulit ayam. Also from ada minyak kelapa sawit, which is palm oil, which is very heavily used in our culture lah, dining culture apa. Mentega, minyak sapi or ghee contains a lot of saturated fat. Santan dan kerisik, produk tenusu, so dairy products, macam ice cream, susu memang ada saturated fat, and then also susu manis also contains a lot of saturated fat. Next, for unsaturated fat, the difference is this is usually macam healthy oils, for example macam olive oil, sunflower oil, corn oil, canola oil, many examples of healthy oils. Avocado is a famous one, which contains unsaturated fat. Nuts also have unsaturated fat, and then also fish oils. So I know that I didn't mention a lot about cholesterol. What cholesterol is, it's macam sort of like candle or waxy punya substance. Memang diperlukan untuk fungsi sel-sel dalam badan. Tapi our liver atau our hati andang menyumbangkan 60 to 70% of the cholesterol from our bodies. Yang famous dulu-dulu pasal kolesterol ni, jangan makan seafood, jangan makan kuning telur because it can raise your cholesterol. Itu yang famous lah dulu. But from macam current research and studies, it's shown that kalau intake of macam seafood dan kuning, the egg yolk, it will not significantly raise your cholesterol level kalau dibandingkan dengan lemak. So the kaitan pengambilan lemak with our kesihatan is mainly to do with lemak tepu atau saturated fat. Ia boleh menaikkan kita ni punya paras kolesterol. And then from our population study, dalam 74% of kita ni punya population has high cholesterol. And then it can also memang berkaitan untuk mendapatkan stroke atau penyakit jantung, which can be apa namanya ni? You can reduce the effects of high cholesterol by taking in lemak tidak tepu atau unsaturated fats to reduce your cholesterol level. So tips untuk mengurangkan pengambilan lemak, we have quite a few. So try to kurangkan atau avoid pengambilan lemak tepu and go for unsaturated atau lemak tidak tepu. Limit makanan yang bergoreng, so all your cucur, your deep fried nuggets kah apa, try to limit your intake. Maybe have one or two servings a week saja, or if you can cut it out completely, lagi baik lah. You can try to go for stir fry instead because the use of minyak is much less, and you can also gantikan the use of minyak kelapa sawit dengan minyak masak yang lebih sihat. So with the healthier oils, you can try to experiment lah memasak di rumah with the healthy oils. Hadkan pengambilan makanan yang berproses. And then untuk mengurangkan kolesterol juga, usually a lot of medical professionals will say makan amping, makan oats, tambah lagi vegetables, tambah lagi fruits in your diet, which is true. This can help with your cholesterol levels and reduce cholesterol. So since it contains a lot of fiber atau serat. And then also sama lah juga, we try to hadkan atau elakkan mengambil snack-snack yang tinggi lemak, and try to gantikan dengan healthier snacks macam buah-buahan, atau if you go for kekacang, also look for the ones yang unsalted. And then again, to do with the healthier choice logo, macam logo yang sebelah kiri ni, because it will be easier and faster if you try to look for this logo instead of membaca nutrition information panel. So make sure to read label makanan, carilah yang kurang atau rendah atau tanpa lemak. And then last, yang paling last sekali, I'm not going to touch banyak pasal pengambilan gula. It becomes a very big topic lah. Banyak information yang saya ingin kongsi, tapi masa is quite limited. So in terms of pengambilan gula, ia boleh meningkatkan berat badan berlebihan, menyebabkan berat badan berlebihan atau obesity, which also is related to risk of other non-communicable diseases seperti diabetes dan stroke. So I will stop di sini. I think there's a question and answer session lepas ni. So thank you very much for having us this morning.
Terima kasih Puan Siti Nadira for sharing such useful insights about healthy eating, termasuk tips mengurangkan pengambilan garam dan pengambilan lemak. Ini peringatan buat kita semua, especially for those of us who love our food. Seperti yang dimaklumkan oleh Puan Nadira tadi, hanya kurang dari 1 sudu teh garam sehari saja. Dan read your labels. Okay, read the labels on the food packs. Baiklah, sebelum kita meneruskan kepada sesi soal jawab, may I again invite Dr. John. I understand Dr. John has a few more to share with us. Dr. John, may I invite you please to take the floor again?
Yeah, thanks for the excellent lectures from the health promotion group, both the mental health and the diet. I think these are quite important for stroke and especially the mental health. I mean, the mental health, I think, it's not only the patient that is affected, it's also the relatives, the family that gets affected. The patient gets affected because you are in your the peak of your life, in the sense of 40s and 50s, and then you have a stroke. Your one side is weak, and you find that you can't do anything. Even drinking a glass of water, or going to the toilet, or helping yourself from the bed to the chair, everything is a big problem, and you have weakness of one side. And if you have a stroke which affects your speech center, you're not able to communicate. There's so much of frustration that comes along with it, especially if you're an active person, very active person who has got a lot of plans. A stroke can devastate it. It's like, I mean, I usually say this example, it's like having a laptop. I equate the heart to the power. I mean, if you don't have a power, you're gone. I mean, after some time, you don't have to worry about yourself, and the family just has to move on. But imagine you have a computer which works, but your apps are all not working. Imagine the frustration of opening the Word and you find that the Word is not working, or the PowerPoint is all jumbled up. It's total frustration, isn't it? Because you feel that you have something that is there, a body there, but you can't make use of your body. So there's a lot of frustration, and the problem is for the family too. Family to get adjusted. I mean, I go to some families, and I mean, I also find this from the patient. You have a young adult who's got a family, children dependent on him, and he can't go for work. And because he can't go for work, he can't provide for the family. And he has to sit at home and he has to watch all this. Can you imagine the thoughts that go through his mind, that I'm supposed to be actually working and taking care of my family, and here it is that the family finds I'm a burden. I'm a burden to this entire family, and I can't even take care of them. The frustration is incredible. And for the family too, I think it's how to deal with the person. I mean, the wife has to start now thinking of looking after the family, but then quite a lot of her time is also used up in taking care of the patient, making him, he wants to be fed, he wants to be moved from the bed to the chair, and there is chaos in the family, and stroke is devastating. It's truly devastating. And so I just wanted to tell you that it should be our endeavor. We should try our best to recognize it and then see how we can control it. And the three things that I just wanted to focus, and which we focus in our World Stroke Day from PJC, was high blood pressure, diabetes, and cholesterol. Now, high blood pressure, I was quite surprised with the number of strokes that we have. I worked in different parts of the world, if I might say so, and I've never seen this many strokes. And I think it's partly the culture. The culture of, I mean, there's, let's eat something, and I find that every break you end up eating something. Now, as you grow after you're about 30, your body's metabolism is going down. You don't need much food. You don't need to eat the way you're eating and when you're 20 years old, or when you're 25 years old, when you're active. And as a metabolism goes down, the amount of food or the energy that is required is much, much less. And therefore, one of the best ways that you can take care of yourself is to decrease the amount of food that you take, just the amount. And if you can decrease that, that will be a great thing. Now, so the three factors is basically blood pressure, diabetes, and cholesterol. What are the numbers like? Now, the reason I'm putting out these numbers is because I believe that nowadays, in those days, blood pressure monitoring was not easily available, but now it's available for everyone. And therefore you can buy automatic BP monitoring apparatus from the shop, and you can measure your own blood pressure. There are two numbers there. One is the one on the top and one that is there at the bottom, called the systolic and the diastolic. The systolic is should be around 120 to 139, and diastolic 80 to 89. Now, hypertension is when you find that this is more than 140 and diastolic more than 90. So if you have severe hypertension, the blood pressure will be more than 180. That's ridiculously high. And then diastolic more than 120. So these two numbers, I think you ought to remember. I think it is better that you keep both these values within the normal range, and that would be a great way to control your hypertension. What I've been trying to promote to my patients is to have a blood pressure log. If you are diagnosed to be a hypertensive, then get yourself a BP apparatus and measure your blood pressure in the morning and in the evening, and see whether your blood pressure, not every day. What I'm saying is, initially, once the blood pressure is stable with your medication, then you don't have to keep on measuring it every day. You can measure it once in 2 weeks to make sure that everything is within normal. So note down your date, and then take the blood pressure reading. And if you find it's a little high, you probably want to take one more reading, and then write down the medications that you're taking. Keep it down there. So these are the medicines. So the next time you go to the doctor and say, listen, doctor, I think in spite of taking these medicines, my blood pressure is still not controlled. Then you can adjust the medications. You can increase the medicines, or you can probably decrease the medicines if your blood pressure is too low. So maintain a blood pressure log, maintain a book, because many a time when I ask with patients and they don't even, I feel sad because it is not my blood pressure, it is your blood pressure. It's your health you're talking about. So please take ownership of your health. So I don't want to go into the thing, but the 3 S's are easy to remember: salt, sugar, starch. Just control them. And salt, it is elegantly put in by Nazira. It's so much of salt in our food, so much of salt, and you unknowingly are taking quite a lot of salt. And sugar, everything gets a lot of your carbohydrates converted into sugar. So eat less amount of food. A lot of people say, I'm going for a walk to reduce weight, and I can tell you probably the amount, if you look at your gym equipment, you find that you lose about 200 kilocalories or whatever, and the amount is probably equal to 1 banana. You just cut off 1 banana, you probably don't have to walk for 20 to 30 minutes. Or, if you just cut down on your food, a whole lot of calories is gone. But you please go to the gym because it is good for your heart. Not eating a banana is not going to strengthen your heart muscles. So you need to strengthen your heart muscles. You need to work out. But all I'm trying to highlight is that try and reduce the calories. Now, I just wanted to say, what are the regrets that people have? And at the end of it, they have a lot of regrets. And the main regrets are, her medicines were given on 3 months, and she did not know that she had to continue. Just wanted to tell you that this is, hypertension is not like a fever. It's not like you take a paracetamol, the fever goes down, and then you stop taking paracetamol. You have an infection, you take antibiotics, and then the infection settles down. You don't need to take any more antibiotics. But that's not the hypertension. Hypertension is something that you're going to live with it. It's your lifelong disease. So you can't just take medicines and then say, oh, my hypertension is probably gone away. It doesn't go away. Hypertension is a lifelong disease. So please do not miss any dose. Always keep a log and measure your blood pressure and keep adjusting the medications depending on what your blood pressure is. The second thing is that people take medicines for a long time, and 1 year, 2 years, 3 years, and after that they get bored, and then they say, it's been there, I've been checking my blood pressure, it's been okay for 2-3 years, so I think my blood pressure is okay, I think it has all come back to normal, so you stop medication. Now, the important thing you have to remember is that your blood pressure is normal because you are taking medicines. Not because you're not taking, if you're not taking medicines, your blood pressure will come back, will become high again. So if you don't take blood pressure medicines, your blood pressure is definitely going to shoot up. So please do not take medications. And if you are adjust your medicines by yourself, and I've found this many a time where I had one patient, I said, you haven't taken medicines. And she said, no, but I'm taking it from my sister-in-law because she's having the same medicines. I said, but what about her when she's supposed to take those medicines? So it's not like you can keep, adjusting the medicines. Please take your own medicines. Don't borrow medicines from others. Don't stop the medications. Don't fool around with your blood pressure medications. And then the third one is the person who says that he takes medicines regularly. He takes it regularly. The thing is, sometimes I note that medicines are given for 1 year. And in Brunei, I've seen many times it is prescribed in the clinic for 1 year so that the patient doesn't have to come. But then nobody checks in those 1 year whether the blood pressure is actually controlled or not. I mean, if you're taking medicines, the idea is to control the blood pressure. And if your blood pressure is not controlled, then you have to adjust the medications. So taking it for 1 year and saying that I've been regularly taking it, but not having a blood pressure control, it doesn't just make sense. So take it regularly, don't miss a dose, and remember it's a lifelong disease. Again, just sharing it, it's the logo for our stroke day. Basically, it's precious time, brain is precious, and then so take care of it. I finished my presentation.
Thank you, Dr. John. And can I just repeat what Dr. John has mentioned just now? Please take ownership of your health, yes, as Dr. John has mentioned, and reduce the calories and the 3S untuk dikawal: salt, sugar, and starch. So thank you very much, Dr. John. And we will move on to question and answers. So to our presenters, we'll move on to question and answers very soon. Alhamdulillah, kita sudah pun mendengarkan pencerahan daripada pakar-pakar kita. Kita akan meneruskan kepada sesi soal jawab dengan memetik soalan-soalan daripada Slido. So this is the Slido. We're sharing the screen. Shall we take the first one? Why do sometimes we see people collapsing during sports activities? Anything vastly related to strokes as well? Dr. John, would you like to take this?
Yeah, you can collapse because of various reasons. I mean, if you have a heart condition, and if suddenly if your rhythm, the heart rhythm is gets disturbed, then the blood supply to the brain is affected and you can collapse. You can collapse if the blood supply to the brain is less. I mean, it could be because of a stroke, it could be a general drop in blood pressure, or it could be that the rhythm of the heart doesn't permit it to beat, and therefore beat normally and regularly, and therefore there is a slight rhythm changes, and therefore the blood supply to the brain is lost, and therefore you lose consciousness. So the net effect is that the blood supply to the conscious center is affected, and therefore you lose consciousness and you fall down. And it could be mainly a heart, and the heart can affect the brain.
Okay, Dr. John, and then we have, thank you, Dr. John. We have questions on blood pressure here. I think I'll couple it together. So there's a question on, can a person get a stroke with normal blood pressure? An individual has no hypertension history at all. And there's another question that's asking, how does hypertension happen? Is it because of food intake, daily food intake? And what are the early signs of hypertension?
Right. Okay. Now, hypertension, basically, there are some people who can be congenital because of your heart issues. There are problems with the heart. You have primary hypertension. Some have hypertension as you grow older because of the blood vessels become a little more rigid, and therefore it is not as pliable as, and therefore the heart has to beat a little more stronger for the blood to reach different parts of the body. But as the main thing is, second thing is the relationship between kidney and hypertension. I think that is to be stressed, and that is because the diabetes affects the kidney, and once diabetes affects the kidney functions get affected. And once that is affected, there are a lot of what you call hormones that are released in the kidney, which affect your blood pressure, and therefore your blood pressure gets affected. Your blood pressure tends to increase, and any patient with a kidney disease will have high blood pressure. So as you grow older, if you're a younger person, then it is possible that it is related, somehow related to the heart, or the fact that you have secondary hypertension. What it means that you have other causes which can lead to hypertension. But as you grow older, it's likely to be primary hypertension, and it could be kidney related, or it could be just an essential hypertension. You have a family history of hypertension, you can probably have hypertension in your family. So it's something that it can be at both groups, the younger age group and the elderly age group.
Thank you, Dr. John. There's a question about, in general, how many stroke patients achieve a full recovery, and what is the contributing factor?
Full recovery is what? It's in the sense that, as I said, if it's a mild stroke, if the bleed is mild, if a small blood vessel is affected, then you probably can get away with it. Now, two things you have to remember. It's when a stroke affects the young, the surrounding brain sort of takes over some of the functions, and therefore you're able to recover. I mean, the brain is slowly learning a lot of things, and therefore when you're young, if you have a stroke, you find that the surrounding brain is flexible enough to start taking the function. When you've grown older, generally it's a decline. Things are declining, and the brain generally is becoming old. It is not as young as it used to be. It cannot take in the functions, and therefore, if something is affected, the ability to take over the function is less. And therefore, your recovery is less. So it all depends on, you can have a small stroke in a critical area. It's just a small stroke in the scan, but it is in a critical area, and you find that your speech is affected. It can be the area where your vision is there, and your vision is affected. So that can be devastating, but then it's a small stroke. It's like a road, and then if you have in a critical road, one small block can cause a lot of problem. But if it is in the countryside, one road is blocked, you have other areas through which you can still bypass and go around. And so it all depends on the area that is affected, how badly the stroke is, whether it is a bleed or an infarct. As I said, bleed tends to damage the brain, and it bleeds and it destroys. And that can mean that even the normal brain around is also destroyed. And so you find that his ability to pick up is less, come back to normal is less.
Okay. Dr. John, maybe I'll take another one or two and then I'll move on to the ladies perhaps. So maybe Dr. John, what's the maximum time for a person who suffers from a stroke to be given medical attention? As we know, every minute is precious. So I guess it's the window period.
Okay, the window period. Now, when you have a stroke, you have the center of the area, which probably would die. Okay, you're probably not going to recover that. There will all be some deficit. But then we're looking at trying to protect the area around, because there's so much of what you call collateral supply, blood supply from other blood vessels are also trying to supply the same area. So we are trying to, sometimes what happens is the ability for the surrounding blood vessel to supply blood is affected. And therefore more damage happens. So if you, earlier on, we used to say, if the stroke is, it has happened, the brain is damaged, but now a lot of studies have realized that you can try and recover it. So there is something called a thrombolytic agents. You can give it within 3 to 4 hours. You call 911, get down, diagnose, get a CT scan done immediately, diagnose your stroke, and then you can inject a thrombolytic agent. It goes into the blood circulation and it lyses the blood clot and opens up the pathway for blood to flow. So if it is done in 3 to 4 hours, you are able to start thrombolysis. Sometimes you can, right now we do have other options where you can do an angiogram. You can put a small catheter into the blood vessel, go up to the place where it is blocked, and you can remove the mechanically remove the clot from inside. Now, these are two for the clots inside the blood vessel. But if it is a clot outside the blood vessel, it is ruptured and it has come out, and therefore you have to operate, and that's where I come in. So we have to do a operation and then craniotomy, open the skull, and then get inside and then evacuate the clot. Evacuating the clot, I have evacuated the clot and it looked good on the scan. But remember, the damage has happened at the time of the rupture. It is destroyed. It's like after the floods, everything is calm and everything looks quiet. But the fact is that during that storm, a lot of damages happened. So during the rupture, a lot of damages happened. So removing the clot, he's not going to become normal.
Thank you, Dr. John. We'll give Dr. John a couple of minutes break, and we'll pick some questions for our guests from HPC. Okay, Ms. Nazira, what are your perspectives on people suffering from mild or less severe depression? Is this a sign of mental illness or simply having poor mental health? Would you like to take this, Nazira?
Yes, thank you for the question. So people with, I guess, less severe or mild mental illnesses, yes, it is still considered as a mental illness. However, again, as I mentioned, macam normal fluctuations of mood itu, I guess you can say that it passes, after a day or two, or even a few hours, it might pass. You might feel sad one moment, you might feel anxious about, having to give a presentation or things like that. You can feel anxious, you can feel sad for a bit, but it will pass after a few hours and perhaps even a few days, according to the severity of the situation. Tapi it does not sort of impact on your daily function. So it is considered as a mental illness once it starts impeding on your daily activities. And yes, people there is such a thing as mild or less severe depression. And the form of treatment would be different. For example, you might only have to go and see a psychologist. As for people with more severe depression or anxiety, would have to go and see a psychiatrist as well as a psychologist. So it's also important to note that for two people being diagnosed with depression, for example, they have the same diagnosis, tapi they might present their depression in different ways. So depression can show itself in different signs and symptoms. So I guess to answer the question, to have poor mental health will perhaps eventually lead to a mental illness, and it might start off as just a mild depression, and then if that's not, if you don't take care of yourself and you don't get enough social support at the sort of early stages, then it will lead to a more severe mental illness. So it's very important to sort of nip it in the bud earlier on when you do see yourself having a lot of stress in your early days, then it's very important to nip it in the bud and sort of practice good self-care, practice good lifestyle changes to take care of your mental health one step at a time, so that when you do encounter stressful situations, it's easier for you to sort of get back up and be more resilient.
Okay, thank you, Nazira. Maybe you'd like to take on another question. If someone feels anxious every morning, waking up without reason, is that considered anxiety disorder? What can be done to reduce anxiety?
Anxious every morning without reason. Yes, that is a sort of telltale sign of having an anxiety disorder. But I guess, again, as I said, if it starts affecting your daily life, and also if it sort of stretches out into 14 days, usually that's when we say, okay, if it starts affecting you for 2 weeks, then perhaps you should go and see a professional about it. Again, it can be, what can be done to reduce anxiety? It can be, going for daily exercises. It can be reevaluating your life, try and see what is actually causing that anxiety. Is it from work? Is it from your personal life? How can you balance things and make things come together? When we talk about work-life balance, usually people think that it means 50-50, 50% of attending to your personal life, 50% attending to work. But for us, it's more of a work-life harmony where both aspects of your life, your work life and your personal life, can come together in harmony and can work well with each other. So it's not, 5 hours at home, 5 hours at work. It's more of, does it work well together, hand in hand? So reevaluating things and reframing your thoughts in the sense that, when people get anxiety, they think of it's like thinking that there's impending danger that's about to come to you, but actually there's nothing. So try and see what the facts are instead of thinking of hypotheticals. Try and be present with, be mindful of the present moment instead of thinking, oh, what if this, what if that? Think of, what's in front of you and what is actually true and is factual instead of thinking about the hypotheticals. Those are just some of the tips to reduce anxiety, Laha. But if you feel that in the past 2 weeks, you've been waking up every morning with heart palpitations and feeling anxious, and it's starting to affect your day-to-day living, then I do suggest that you go and seek professional help and see it's good to see them now rather than to see them later when you might even need to, get medication for it and things like that. The treatment plan will be much more extensive than if you go now. Yeah.
Thank you, Nazira. Let's have a question for Nadira. Nadira, adakah Brunei ada hari kesedaran kurangkan garam? Jika ada, ianya kurang didengar.
So hari kesedaran kurangkan garam. In the Pulang, we don't have hari kesedaran kurangkan garam. Usually hari kesedaran or like hari-hari ini is usually to do with medical conditions atau diseases lah. Tapi in the past, Health Promotion Center dan Kementerian Kesihatan have been doing macam campaign atau media campaigns lah. That is unfortunate lah kalau indah sampai arah orang ramai. Tapi we have done work with macam membuat videos, media campaigns lah, mass media campaigns juga. Try to make posters and macam infographics in terms of salt ni. I think ada more upcoming work lah for us to do sebab we have our own salt strategy team. Di Pusat Promosi Kesihatan, so they are the ones yang will be handling a lot to do with anything to do with salt related lah. So we have a specific team that will jalankan all of the programs and any of I think working on policies and such lah juga. So thank you for that question. It's nice to get feedback lah macam that we need to do more work or be seen and be heard more lah. So thank you very much for that question.
Okay, Nadira, maybe you can take one more. There are varying types of salts. Are they all equal when it comes to how they affect one's health? Are some salts better than others? Example, Himalayan salts.
So I wanted to touch on this in my presentation, tapi of course with the limited time, but thankfully it came out as a question. This is one that we usually receive from our audiences because there's different types of salt, like sea salt and then Himalayan salt, rock salt. The difference between these salts, I think the most noticeable will be the taste. Some of them don't taste as salty as the other. So, but in terms of sodium content, they are all the same. So all of them will affect, if you take it if you change your salt, it can still affect your blood pressure the same way. So it doesn't really matter which one you use. I know some of them are like marketed as healthier and such, tapi the sodium content is basically the same. So it can still affect your blood pressure. So in general, just to reduce, if you can eliminate also no salt pun, anything that you can try to do in terms of reducing your salt intake is a big step.
Thank you. Maybe just one more, Nadira. Yeah, Nadira.
Keep it coming.
What should we do? I know. Where is it? Are fat diets, keto, Atkins, a good way to achieve a balanced diet? I'd like to know this one too.
Okay. This is also a very popular question that we get. So for those young in the tahu, what keto and Atkins are, is to do with a very low fat, low fat, sometimes high carb, high protein diet, and just to try to eliminate or really reduce the amount of carbohydrate in your diet. From MOH's stance and perspective, our recommendations is actually to have a balanced diet. So keto and Atkins or fat diets are not actually balanced because you're not getting all of your nutrients. So you're really cutting down drastically your carbohydrate intake, whereby you actually need the energy from your carbohydrates. Some of these diets also it's kind of it because you're not getting all of your nutrients at once, all your nutrients from your diet. So we do not recommend this. Yes, you can lose a lot of weight doing this because you're really cutting down your carbohydrate intake and your fat intake. However, this is not a diet that is sustainable. It's not something that you can keep doing and maintaining in the long run. So we really do not recommend to do such diets, as you will lose weight. You can lose weight drastically also from these types of diets. But by doing so, your body is not catching up to the changes that you're doing with your diet. So for example, you lose a lot of weight, and then your organs are trying to catch up with the changes that you're making. So it can really affect your body as a whole. It can affect your whole lifestyle, and it is not sustainable, and you can't really maintain it in the long run. So what we do advise is just to make, simple, healthier changes. You can reduce, for example, we have something called like a healthy plate. So you can practice, having a quarter of carbohydrates on your plate, a quarter of protein, and then try to fill half of your plate with vegetables and fruits. So increase your fruits and vegetables intake. Reduce you can reduce your carb intake. You can change, you don't have to eat. Some people say, boleh makan nasi. They say cut out your nasi lah, because nasi ni jahat, and so on and so forth. However, it depends on how much you take. It depends on how you moderate your diet and the sources of carbohydrates, the sources of protein that you have. So diet is a very, very big topic. Usually you would have this on its own. But it's nice that we can collaborate with Dr. John from PGSC, and then to also include mental health aspect as well. So this is overall for stroke. So again, thank you for that question. I hope I answered it in a way.
Thank you. Thank you, Nadira. That's very interesting to know. Can we move to Dr. John again?
Sure.
We have a couple of questions. What should we do if someone has a stroke or heart attack at work?
All right, if you suspect that a person has a stroke, I mean, as I said, the last letter in the acronym is T, and that's time to call. It's time to call someone for help. So protect the patient, in the sense, make sure that he is not going to vomit, or he's just resting, he's lying to one side so that his airways are protected, that he's, don't crowd around him. Just make him comfortable and call for help. And I think that's probably the best. Out here, we have an excellent ambulance system. I think you probably will have an ambulance at your doorstep within 15 to 20 minutes, and then your job is done. So I think if you have a person having a stroke or a heart attack, I'm not the specialist in the heart, but the idea is to just make sure that you call for help, primarily call for help, and then give the first aid as best as you can.
Thank you, Dr. John. And in Brunei, what are the treatments for stroke patients? I think you mentioned one just now, Dr. John.
That's true. Sometimes what happens is some of the minor strokes, you probably don't have much. So you don't have much to do. If it is a reasonably big size clot, then you can try and lyse the clot. I mean, to break the clot with medicine. So you can give a thrombolytic agents, and you can thrombolize that that clot and re-establish the circulation. The second thing is to do a mechanical thrombectomy, wherein you put in, as I said, through the blood vessels, you send a small catheter to that point where the clot is blocking the artery, and then remove that clot mechanically, actually to suck it out, so that you can re-establish the circulation. So these are the things. But then not every patient is a candidate for these. If you have a minor stroke, then you're not a candidate. If you're past the time period, many times people go to sleep and then they wake up finding that they have a stroke. So you're really not sure whether you had the stroke at 12 o'clock in the night or whether you had a stroke at 5 o'clock in the morning. So you come around 8 o'clock, you're not sure whether you're within the 3 hour or 4 hours or 6 hours time period. But one of the things you can do is what we do is we do an MRI scan immediately. For example, in BNSRC, you get wheeled in and they give the first aid immediately, and then they get a scan, MRI scan, probably within 10 minutes, you can get an MRI scan. MRI scan is, as compared to a CT scan, is highly sensitive. And therefore it can tell you and approximately tell you what the age of the stroke is. And then if you are a candidate, then they probably would thrombolize and give you the thrombolytic agents. You can thrombolize, you can reestablish the circulation, but if the place where the blood is going is already dead, the neurons are dead, the brain cells are dead, then re-establishing the circulation really doesn't help. So you might find that it looks good, the blood is now started to flow, but the blood flows to an area where the neurons are dead, and therefore the neurons are not going to function. So it all depends on how big a stroke it is, what type of stroke it is, the time period. So there are a lot of other factors that come into play when we initiate the treatment. Sometimes you're past the time period. And if there's a bleed, you cannot give a thrombolytic agents, and you cannot do any, there's no thrombectomy, mechanical thrombectomy that you do. So if it's a small bleed, we just wait. I mean, there's no point opening a skull and going through the brain to remove a small blood clot. The body absorbs the blood clot over a period of time. So if it is not causing much of a problem, if there's a small bleed, as I showed in some of the CT scans, there's a small bleed, you just wait on it and the body does the rest. The body will heal and the body absorbs the blood over a period of 2 to 3 weeks. But if it is a large blood clot and it is causing severe pressure, making you you're unconscious, then you have to operate. You have to operate and remove the blood clot. And the blood clot is not to save the disability, it is to save your life. Because so there's a difference between saving life. It's called a life-saving surgery. I just want to save your life. But at the end of it, after doing the surgery, you still find that you're actually paralyzed. I mean, that is different. It's a life-saving surgery versus limb saving. I hope that answers.
Thank you, Dr. John. Very comprehensive. I'll couple up these two questions. Are strokes hereditary, and can seizures be mistaken for a stroke?
All right. Let me tell you, the thing is, I give a very, very simplified version of what a stroke is. It's a highly simplified, it's not as simple as I put it, but the whole idea of my presentation was to convey to you as to what happens in a stroke. So don't go with this very simplistic idea. Life is not as simple as I've made it out to be. Stroke is quite complicated. Is it hereditary? There are some type of diseases which are hereditary and which can cause, one of the complications of that disease is stroke. Some of the familial genetic diseases can cause stroke. So yes, there are some strokes which are hereditary. Now, there are some strokes where there are abnormal blood vessels in the brain. The blood vessels are not like the normal blood vessels, just as you have varicose veins. When you see varicose veins, the veins are quite bulging, etc. There are some abnormal veins. We call it the arteriovenous malformations. That is sort of seen in the younger age group. It is, you're born with it. And sometimes you can have a bleeding from the AV malformations, and AV malformations can cause bleeding. Aneurysms, some families are prone to have aneurysms. And therefore, if you're prone to have aneurysms in the family, sometimes you find that your sister has aneurysm. Aneurysm is basically a small bulge in the blood vessel, and because of high pressure, the bulge ruptures. So that can be hereditary. And then you can have kidney diseases which are hereditary. And the kidney diseases are hereditary. And because the kidney diseases cause high blood pressure can cause strokes. So there are some diseases where it can be hereditary. I think the best thing is for you to ask your doctor whether it is a hereditary problem. Some people have high cholesterol goes in families. You have familial hypercholesterolemia, and that can cause high stroke rates. Diabetes is hereditary. And therefore, if your parents are diabetic, there is a high chance that you're going to be a diabetic. And if you have so you got to be on the lookout to see whether you have started getting diabetes, whether it has started affecting you, and therefore you have to take measures to control the diabetes. If diabetes is not controlled, that can cause a stroke. So stroke is the end result of a lot of other factors. I mean, the blood pressure, the cholesterol, and the diabetes. So, and all those can be hereditary.
Okay. Dr. John, usually we heard about mild stroke. What is mild stroke? And then about the seizures. Can seizures be mistaken for a stroke? And could constant sinus, migraines, or headaches be a possible indicator of blood clots into the brain?
All right. Okay. Can seizures be mistaken for a stroke? Now, the seizures is basically because there is some point in the brain which is irritable, and that it sends out a spark. It is irritable and it sends out a spark, and the spark spreads across the brain and you have seizures. I mean, I'm putting it very simply. Okay. Now, stroke does not cause a seizure. But if you have blood coming out of your blood vessel, that blood can irritate the brain around, and that can lead to a seizure. So some instance of strokes, you can have a seizure also. But usually stroke is independent, different entity, and seizures are different entities. But can you have an overlap? Yes, you can have an overlap. You can have strokes leading to seizures. Sometimes seizures can lead to strokes in different ways. I mean, you have a seizure, you have a fall, and then you have a blood clot in the brain, and that can lead to a damage in the brain cells, and then you can have weakness or deficits or whatever. So, but they are two different entities. I probably wouldn't mix it up. Then what is a mild stroke? Mild stroke, I think, is basically you're lucky in the sense that it is a small blood vessel that is probably affected. And if it's a small blood vessel that is affected, it does not damage much neurons. Or it may be a stroke which is affected a non-eloquent area of the brain. We call it the non-eloquent. Every part of the brain is important in your function, but there are some parts of the brain which we don't use as much. And for example, if the frontal lobe, and if your frontal lobe is affected, it affects your personality. It affects your outlook. But it is not easy. You will be walking around and doing a normal function, but it affects your personality. And that maybe a person who doesn't appreciate the personality changes may say it's a mild stroke. And so the stroke mild is basically as I said, the bleed is small, or it's a small blood vessel, or it is a non-eloquent part of the brain that is affected, and therefore you get away with it. But remember, if it is a small stroke, that it is probably a small part of the blood vessel that is damaged. If there is a damage, then other parts of the blood vessels are also likely to be damaged. So you can get a big stroke. So be careful that you might end up having a big stroke. Can migraines and headaches be a possible indicator? Migraine is something we call it a migraine when we rule out all the other organic causes. When you find that there is no organic cause for a headache, we call it a migraine. And then migraine has got a particular type of headache. It's a particular type of headache. But some of the headaches that you get, like for example, we have arthritis, a temporal arthritis. You can have a stroke. It can affect your vision. Arthritis is basically inflammation of the blood vessel, and there is some inflammation of the blood vessel, and that inflammation can lead to a blood clot. So you can have some type of headaches in giant cell arthritis, vasculitis, which can cause strokes. Blood clots in the brain, it's blood clot inside the blood vessel, and that can lead to a stroke. So yes, but I probably wouldn't mistake, it's not an indicator of stroke, no.
Okay.
Is dementia connected with stroke? I see one question. Yeah, if there are multiple strokes, you had multiple small vessels having stroke, multiple areas of the brain are affected, you can have dementia. Dementia basically means that a lot of your cognitive functions are gone. If multiple small parts of the brain are affected, you can't function normally. And that leads to dementia. If your memory cells are affected, you can't remember things. The path from your workplace to your house, that's a memory that is stored in your brain. If the blood clot has affected that nerve cell which has stored that memory, you can be in the office and then you suddenly say, I don't know how to go to home, because you've forgotten the way to reach your house. So it's all this cognitive abilities is basically are different parts of the brain which subserve those functions. And if they are affected, you can have dementia. But one major stroke, dementia, probably no, but personality changes, yes. And a whole lot of other mental health issues as was enunciated earlier.
Okay, maybe one more for Dr. John. Any particular age group that has higher risk of stroke, or it actually depends on existing medical condition?
Okay, generally it's, we've done a study about of the strokes that come to our centers in the last 4 to 5 years. We found that there are about 300 to 400 patients every year who come with a stroke. So on average, we get a stroke a day. So it can be a mild stroke. It can be a person who's had a stroke who's come back with another stroke, or it could be a bleed. It's generally the males which are affected more than the females. And also it is, the bleeds are more commoner among the males. And the age group is usually the productive years, I would say 40s to 60s. But there are some strokes that happen in the elderly. Like I said, a chronic subdural hematoma, the blood clot found outside the brain. And that is usually seen in patients who are in the elderly, 70 to 80 to 90. I've operated on a 93-year-old lady also with a blood clot. So what happens is they have heart disease, diseases, and they take aspirin, they take clopidogrel. These are basically blood thinners. These medicines basically prevent clotting from taking place. And then you have the brain shrinking, so there is a potential space between the skull and the brain, and therefore any minor trauma, any minor fall can lead to a blood clot in that space, potential space, and that can increase and cause dysfunction of the brain. So aspirins and all these blood thinners, sometimes you give anticoagulants like warfarin, you give for patients to prevent the blood from clotting, especially for heart diseases, those can cause a stroke. Because usually once you have a small bleed, the body tries to staunch that bleeding. But if the normal mechanisms are not available because of your medications, then you will continue to bleed. So generally, to answer in short, males are at a more higher risk than females, and then the age group that is more affected is maybe 40 to 60s, but the younger group and the older group are also affected, though the pathology is different.
Thank you, Dr. John. Okay, we'll give Dr. John a couple of minutes break. Let's move on to other questions. Perhaps Nadira, this one is probably for you. What are your views on perhaps reducing advertisements in fast foods and more on healthy nutrition?
All right. Thank you for this question. I like this question because this means that whoever's asking this is on our side. Because in terms of like advertisements, marketing, we know that industry is like a bazillion, gajillion dollar industry. So there's lots of money involved with advertisements and making advertisements, and of course, fast food chains, restaurants that actually sell fast food have that money to put up these advertisements everywhere and anywhere. This is one of the biggest, I think, wars that we have, battles that we have, trying to promote healthy eating while these companies have all that money to advertise their fast food or unhealthy options. But we are doing work. We have been doing lots of work behind this. We have something called a code of responsible marketing towards especially children, because from what we know, what science knows, the eating habits that we have as we are children and as we were younger can actually extend throughout our lifetime or our age. So as we get older, if we're used to eating unhealthy as we're younger, this can definitely extend into into adulthood and as we get older. So we have been doing work on doing responsible marketing of unhealthy foods. So I don't know, I hope people have noticed when you go out to billboards, around the kampong areas, around Brunei, I hope that you have seen there are still food advertisements or unhealthy options being marketed. However, there are certain conditions that they need to comply with to be able to advertise their products or advertise their menu items on those billboards. So if they want to make marketing videos and such, there are certain criteria that they need to comply with. I think one of the big ones would be not to include children or toys in their marketing or advertisements in their big billboard posters and such. But of course, the fast food industry companies are very creative. They have their own ways of advertising, making the food look extremely, irresistible and yummy. So when you're driving past and you see a billboard and you can see a huge burger or nuggets, this is how marketing and advertising works, because you remember it as you're walking past or driving past, and then you will think, oh, okay, I'm going to stop by there later. So it is difficult. It's challenging, but we are doing work with this in terms of our code of responsible marketing. We have to do more, and so hopefully within these next few years, it takes a lot of a lot of collaboration. We need to meet with a lot of people. I mean, it's not so easy as to just tell the company that you cannot advertise this anymore, or you have to take down those posters, or you cannot advert. There's so many channels nowadays. There's social media. There's you can do so many things in terms of advertising. So we are trying. We are doing our best in terms of reducing those kinds of advertisements. So hopefully you'll be able to see more of this within the next year, the next few years. It takes a lot of time. So thank you very much for that question. We really appreciate it.
Okay, thank you. Thank you, Nadira. Nazira, you may take that question. Are depression and anxiety common after a stroke? Do you know this, or Dr. John?
I can take this question. I think Dr. John can chime in after. Are depression and anxiety common after a stroke? So I think for mental illnesses, as I mentioned that in one of my slides, the causes and risk factors, one of them for the biological factor too, you can see, as I mentioned today, that one of it being physical health. So having chronic physical health will sort of increase your risk of getting a mental illness. But the reverse is also the reverse also applies, where perhaps the location of the stroke, to where you got the stroke, perhaps impacted on the part of your brain where it controls your emotions, your sort of impulsive behaviors and things like that. And because it affected those spots in your brain, it could also lead to behavioral changes that might be seen as a mental illness. So yeah, it's a big correlation between depression and anxiety, as well as brain damage such as stroke. So yes, I think the numbers are something like a third or 2/3 of people who suffer from stroke actually do suffer from mental illnesses after as well, not only because of the location of the where the stroke hit, but also because of the implications on your lifestyle after having a stroke. It can sort of make you feel hopeless because you can't actually recover and live the way that you used to, and things like that. So yeah, it can cause stroke, and then stroke can cause depression as well. So it's a very high correlation. And yeah, if Dr. John wants to chime in, feel free.
Will you get depression? Absolutely. No question. Imagine you're in the peak of your life. You have plans. You want to change Brunei upside down, and then you have a stroke and you can't even get out of your bed. You need your wife to support you. Can you believe it? You would be depressed like nothing on earth. In a sense, your entire life changes. Mind you that it's devastating. It's absolutely devastating. And anxiety, I think it's for the relatives. What am I going to do with this man around? He's got stroke. He's not earning. He's not. And how am I going to take care of my children? So there's a lot of anxiety for, and you have a person. I have to take care of a disabled person too. Life is never the same after a stroke. And you may get away with a mild stroke. You got to thank your stars. It's a mild stroke. For heaven's sake, don't stretch your luck too much. If you have a mild stroke, please sit down, take it seriously. And there's no question about depression and anxiety. It's a disaster.
Okay, then this is quite related. Dr. John has already mentioned it just now, how devastating it could be and how it does affect family members. So the question is, are there any support? I think from PJSC side, maybe like for the stroke caregivers, is there like any tips?
Well, there is something called, we have a home-based nursing for acute care or immediate care. We have a person who's had a stroke. They have the home-based, they have these medical social worker is there, department is there, and they take care of their needs of the patients, immediate needs of the patient. And then you have the home-based nursing where nurses are sent to the houses and to ensure that they are, the blood pressure is okay, they're taking the medicines, that they don't have any bed sores, they're ambulant, and you know, a lot of other support. But there's only so much that anyone can do. I mean, so it is always going to be limited to acute care. The chronic care, I mean, is going to be affected because a new person comes and I take care of him, and then I'll take care of him immediately. But then another new person has come in, and so then I have to take care of this new person. So the old person sort of fades away. So I feel there is an excellent rehab center here which takes care of it, and they do have group therapy sessions, art therapy, various therapies they have, especially the rehab. We have in Pantai, it's probably one of the best rehab centers that we have in and around this areas. Excellent center. But again, the group therapy sessions is only once a month. Artwork or how to, they have even an area where they teach women to start cooking with the disabilities. How do you reorient your life with your disabilities in view? So in mind. So basically, there is a lot of things that we can do to help you for the acute setting and also the chronic setting. But quite a lot of the burden falls on the family, and that's quite significant.
Okay, thank you, John. And there's a question on hypertension. How frequent should we check our blood pressure for those who have no hypertension?
If you don't have any risk factors, you don't have to worry too much, in the sense that you've probably done it once or twice in the when you've gone for work, they've probably done a medical checkup and they would have said that your blood pressure is normal. But once you're 40s, etc., just check your blood pressure once in a while. And if your blood pressure is on the normal, then I wouldn't worry too much. But your food habit, if your physique, you're quite obese, you don't have much of physical activity. There's a family history of kidney diseases, you have diabetes, you have all these medical conditions, then I would do it a little bit more frequently. But if I'm quite a good athlete and I've taken care of my food habits and I don't have any of these medical conditions, then I probably wouldn't go anxious and say whether my blood pressure is going to increase. Blood pressure is a chronic disease. It increases very gradually. It doesn't suddenly one day decide to, like fever, it doesn't decide to come one day. So if you once in 6 months, once in a year, probably is sufficient if you don't have any of these pre-existing medical conditions. So it all depends on you and what sort of a person you are, how physically active you are, and also your medical conditions. So,
Dr. John, this is interesting. Can stroke occur without any underlying health issues?
Can it affect? If you have a normal, I think it's unlikely, but there is always an underlying issue for it to have happened. And it is something, it is so subtle that you have not noticed it. And for example, your cholesterol is slightly on the higher side, or the fact that you have parents who have given you a set of genes which are not not so great, which leads to diabetes or whatever. Sometimes what happens is you have abnormal blood vessels in the brain, which goes unrecognized. You don't pick it up. I really don't know of the brain because I've never done a scan of my brain. And so we don't do angiograms routinely. So if there are any abnormal blood vessels, then any abnormal blood vessel can rupture and that can cause a stroke. So you think you're normal, but there was something underlying which was not picked up, which had not revealed. It was occult. It was not revealed. But usually there is. And sometimes you can have vasculitis. For example, you have TB infection. TB infection, sometimes the infection can go through the blood and it can go to the brain. And when it goes to the brain, it can affect the blood vessels, the TB. Now, you didn't know that you had TB, but TB can cause arthritis, and that can cause a stroke, in the sense that that blood vessel can get blocked, and that can cause a stroke. Now, brain tumors can present as a stroke. In the sense, a stroke just gently means that an acute onset of neurological deficit. That's it. It can have many factors. A sudden acute onset of a neurological problem. Now, a brain tumor can grow in your skull, in your brain, and you wouldn't even know about it except for mild headaches. And suddenly, finally, there is a bleed inside the tumor. The tumor expands and it destroys some of the adjacent brain, and you can have a stroke. So many times you'll be present with the stroke, and there's nothing that you can do about it.
Dr. John, maybe that one, how useful is the automated external defibrillator in giving early response to suspected stroke patient? Should AED be made available in every ministry?
Automated external defibrillator is basically when your heart stops or the rhythm is abnormal. Usually, stroke doesn't cause it unless it is affecting your center for heart breathing and your heart rate. If it affects the medulla or it affects the pons, it doesn't. But automated external defibrillator is primarily something that you do for the cardiac. I mean, you have a heart attack and the heart stops, the myocardium is stunned, or you find that there is an abnormal rhythm, or ischemic heart disease causing an abnormal rhythm. And therefore, the automated external defibrillator is giving you a jump start. It's giving it a shock and then resetting the rhythm. It's not. Now, let me put it this way. Abnormal rhythm can affect the blood supply and can lead to a stroke. But all strokes are not caused by abnormal rhythm. So AEDs are useful for people who have an abnormal rhythm. I'm a little worried because I don't want people to go about shocking people around. So it has to be for people whom you suspect that the heart is the primary cause for the stroke. And if you think that the heart, so therefore check the rhythm, and if the rhythm is abnormal or he has a ventricular fibrillation or atrial fibrillation, then it's worth giving a shot.
Okay.
I mean, AED should be available everywhere, I think. Yes, it's primarily if you want to save lives, AED should be available everywhere. But just because you have a tool doesn't mean that you know how to use it. It's a fool with a tool is still a fool. I mean, you can have a tool, but if you don't know how to use it, you're still you're dumb. I mean, you're not going to be useful in the situation. So AEDs, definitely, if it is possible, have it in every department, but be careful.
Thank you, Dr. John. Would you like to take some more? Maybe I can move on to maybe Nadira. Not sure if you can answer that. Are there any taxes levied on the 3S? So salt, sugar, and starch. Are there any taxes levied?
Thank you very much for that question. Currently, the one that is and has been implemented the last several years is actually the tax on sugar sweetened beverages. So yes, there is a tax in place. I think it was in 2000, can't really remember, but a few years back, it was already introduced. So there's a certain amount of sugar content in drinks. If it exceeds, then those drinks will be taxed. So with this, we try to promote our the beverages that actually have the Healthier Choice logo, because any of the drinks that actually have the Healthier Choice logos, they are automatically lower in sugar. So we have worked on these taxes with Royal Customs and Excise Department. It's already in place, and some more coming soon. So you might see some changes in price of certain foods out there in the market, possibly. So this is still an ongoing thing that's still happening. But I don't know if from the feedback that we got, people didn't really notice the increase in price of sugar sweetened beverages. Maybe it seemed negligible to them, but there will be some changes coming soon, which I don't think I'm allowed to share. But thank you for that question.
Thank you, Nadira. Anyway, thank you so much to our participants. We have so many questions, and maybe we can just entertain one or two, Dr. John, before we move on to our closing, because there's so many. Let's, Dr. John, I give you your own choices to pick.
Okay, I'll just pick up.
Yes.
I mean, I'm happy. I must thank each one of you for actually participating. I didn't want it to be a didactic lecture wherein I sat and give a big talk. I'd rather have a discussion. So I'm quite happy that people are asking questions, but I probably won't be able to answer every one of them. So I'm sorry if that some of your questions go unanswered. Now, is vertigo a stroke symptom? Now, two things to remember. Vertigo basically means that you have an imbalance. Vertigo, for the balance system, there is a balance system in your ears, okay? And the balance system in the ears is the one which gives information, which tells you whether you're standing, whether you're lying down, whether you're 30 degrees, or whether you're doing yoga with your head down, or whatever it is. That balance system is there. And if there is a dysfunction in the system itself, then you can have vertigo. You can have vertigo because what happens is the brain synthesizes a lot of information, okay, and everything has to be concordant. It has to be in the sense that fit in. If the eye says that you're standing, but if the ear gives you a wrong information, the brain will have problem and you might have vertigo. Okay, so sometimes what happens is, when you're going on traveling on seasickness, you look out of the sea, the brain feels that everything is calm, but then you're moving up and down and up and down, and the ear keeps saying that, listen, there is a movement up and down, and therefore there is a discordance in the input from the eye and the ear, and then you can have a seasickness. So vertigo can also happen if blood supply to the balance center. I mean, everything, all the hearing has to go into that center. So if the brain center for vertigo is affected, you can have vertigo. So we call that as a central vertigo, and you can have the peripheral vertigo. Peripheral vertigo is when something affects your ear per se. Central vertigo is something which affects the brain. Peripheral vertigo can be transient. Brain vertigo means that the center is itself affected, and it can be difficult. There is a person who came to me. I think he went crazy at the end of it, because he kept telling me that he feels that his walk is not normal. And he keeps looking at his, asking his family members, is my walk normal? And they say, what's wrong with this guy? And they say, your walk is normal. But his brain is not able to process it. And it keeps giving conflicting messages to his higher centers, and says that your walk is not normal because he had a stroke in the brain stem. So I had to, I mean, he was a constant companion. I was a patient for over 2 years, I think. And he said, every time I go for a golf, playing a round of golf, he said that he always felt that he was about to fall. He had the feeling that he was about to fall. And therefore he stopped playing golf. So it depends on, stroke can be, vertigo can be a symptom, early symptom of a stroke. But don't worry, that's not, it's usually the peripheral causes. Is usually there's some problem with it may be as simple as having wax in your ears or something, or infection in your middle ear that can have vertigo. So vertigo can be a symptom. Can a stroke patient ever return to the normal state of body and mind? Will it permanently affect their ability to perform work? As I said earlier, if it is a mild stroke, you can get away with it. If you have some deficit, it can always affect your performance. It can always affect your performance. And I think today Nazira was planning to have a group from another person to talk about the effects on a person's work and all that stuff. It can affect a person's lifestyle, yes. Why do medical centers and clinics only check your oxygen level? That's the easiest to check. There's no money involved. It's just have to put in saturation meter and tell you that everything is fine. Blood pressure measurement requires someone to measure. There's a nurse I have to employ to measure your blood pressure, and blood pressure measurements take time. So I suppose the medical clinics will not be very keen on it. But as I said, it's your health, and I take ownership of that. And they don't check the salt. A sodium level is not an indicator whether your salt is high or not. I mean, just because you're taking high salt, the body will excrete it. But the salt affects your blood pressure system. But checking your blood sodium is not the answer. It doesn't. A very high hypertensive can have a normal sodium. So that's not the answer for that. And yes, sugar, I think they should check it. But as I said, it is all about an expense. And there is an expense in using up the dipsticks or checking your blood sugars. And are there anything else? I don't know. I can't see any other. I think I've covered most of the ones that I've seen on my screen.
Thank you. Thank you, Dr. John.
Thanks
Thank you, Dr. John.
Thank
you, Nazira. Thank you, Nadira. Terima kasih kepada semua peserta-peserta di atas persoalan yang telah diajukan kepada penyampai-penyampai kita pada hari ini. Pihak kami mohon maaf tidak dapat menjawab semua persoalan di atas kesedaran masa. Dan Alhamdulillah kita telah sampai ke penghujung webinar kita.